Well, every day about 800 women die from preventable causes related to pregnancy and childbirth. The World Health Organization says almost all these deaths occur in low-income settings as a result of conditions that include severe bleeding, infection, high blood pressure, and complications during delivery. Medical experts say maternal health is closely linked to newborn survival. According to UNICEF, while great strides have been made in reducing global child mortality since 1990, each year 2.9 million newborns needlessly die within the first month, and an additional 2.6 million are stillborn. The main causes are complications due to prematurity, complications during delivery, and infection. These causes are often preventable and treatable. And health experts say poor maternal and child health indicators have been reported in Nigeria since the 1990s. According to UNICEF, Nigeria is one of the largest contributors to the under-5 and maternal mortality rate in the world. Joining us now in the studio for more is Dr. Isaac Adewole, the Nigerian Minister of Health. Dr. Adewole, welcome to the program.
Thank you.
It's such a pleasure to have you. Listen, this is a really disturbing statistic. According to the United Nations, every single day, Nigeria loses 2,300 children under the age of 5, and about 145 women of a childbearing age die. What is your reaction to this as the Minister of Health?
My reaction is that the assertion is true, but there's an opportunity. The current administration in Nigeria is quite committed to turning the tide around. And we've taken quite a number of actions that will really take Nigeria out of this league of shame nations where we have maternal mortality and under 5 and newborn and infant mortality rates that are outrageous.
So before we talk about the actions that your government are taking to address this issue, help us to understand what is the biggest challenge you face in keeping mothers and babies safe.
Well, the first challenge is the fact that many mothers deliver out of facilities due to quite a number of reasons. The first is lack of awareness about the value of delivering in facilities, poverty, as well as illiteracy. And we also have challenges with respect to the north-south divide, the poor-rich divide, and the urban-rural divide. And when you look at the indicators in Nigeria, the health indicators for the rich, for the educated, it's not too different from what you have in the United States of America and Europe. But for the poor, it is worrisome.
So the solution then, or one of the main solutions, will be addressing poverty?
Oh, certainly, to address poverty. And that's why under the current government, we have one of the most robust social intervention programs in the history of Nigeria.
Which is?
Which is to offer support, conditional cash transfer to poor people, offer employment to people who are unemployed, and also improving on-girl child education.
And what type of impact have you seen so far?
Well, it's too early to talk about impact because for you to measure impact, you want to think about 2 to 3, 4, 5 years. But we are quite convinced that over the next couple of years, we will make a big dent.
Now, there are some experts who say that one of the issues is the fact that there are still many women who give birth at home. So how is this being addressed? If we look at the issue of midwives, because many times midwives are they are the very first one to be at the forefront, whether the mother is pregnant or when she's giving birth or after even giving birth. So what is being done on that front?
Well, the first is to make sure that we have midwives available. We are establishing and restoring accreditation to many schools of midwifery, particularly in the northern states. We have what we call a midwifery service scheme, where we are employing midwives either retired or unemployed in some of these critical areas. The other is a new initiative that was launched by Mr. President precisely 1 week ago. We call it the Community Health Intervention and Provider Scheme, where young people are employed, trained to serve as interlink between the community and the facility. The real goal is to make sure that we improve health-seeking behavior and move people away from our homes into facilities.
Now, one of the issues as well is about trust in the health system. And another issue is access. So there are women who live far from the health centers. Other women say when they go to the hospital, they do not receive the care that they need. Perhaps there are not enough health workers, or they do not really have the trust in the system that they need to have. So how do we address trust in the health system when the health system may be broken?
Well, the first thing we are doing is to really reorganize the architecture of the health system in Nigeria. We are putting emphasis on primary care as a platform and the foundation for a reinvigorated healthcare system in Nigeria. Much more importantly is we are also putting resources in this facility. We are also kickstarting the concept of the basic care provision scheme, where we will offer basic care to poor people, particularly in rural areas, in 3 of our states by the end of March this year. And this will be the beginning. We intend to roll this across the country. But empathy is another thing where we also want to teach. We're trying to build level of awareness, educate our healthcare givers that they need to build trust. When you close the gap between the provider and the client, through trust, through offering patient-centered, compassionate care, then people will trust us better and come to the facilities.
Professor Adewole, thank you so much for joining us today.
Thank you so much.
And that was Dr. Isaac Adewole. He is a Nigerian Minister of Health. It was our pleasure to have him today. And that's our health report for today. To stay in touch, find me on Twitter at Linord Moudou.